This medication is used to temporarily treat symptoms caused by the common cold, flu, allergies, or other breathing illnesses. It includes a cough suppressant, a pain reliever and fever reducer, and antihistamines to help with various symptoms. It is important to note that this medication is not usually used for ongoing coughs from smoking, asthma, or other long-term breathing problems, or for coughs with a lot of mucus, unless directed by your doctor. It is also not recommended for children under 6 years old, and certain products may not be recommended for children under 12 years old. It is important to carefully follow all dosage directions and to not use this product to make a child sleepy. It's important to talk to your doctor or pharmacist about other ways to relieve cough and cold symptoms. Remember to always read and follow the directions on the package label. If you have any questions, consult your pharmacist. Take this medication by mouth with or without food, usually every 4 to 6 hours as needed or as directed by your doctor. If you experience stomach upset, taking this medication with food or milk may help. It's important to drink plenty of fluids when using this medication, unless otherwise directed by your doctor, as the fluid will help loosen the mucus in your lungs. If you are using the liquid form of this medication, be sure to carefully measure the dose using a special measuring device/spoon. Do not use a household spoon because you may not get the correct dose. If your liquid form is a suspension, be sure to shake the bottle well before each dose. The dosage of this medication is based on your age, medical condition, and response to treatment. It's important not to increase your dose, take it more often, or use it for a longer time than directed, as improper use, abuse, of this medication may result in serious harm. Remember to tell your doctor if your condition lasts for more than 1 week, if it gets worse, or if it occurs with a headache that doesn't go away, rash, or fever lasting more than 3 days, as these may be symptoms of a serious medical problem and should be checked by a doctor. Some common side effects of nighttime 6.25 Mg-15 Mg-325 Mg capsule include drowsiness, dizziness, blurred vision, upset stomach, nausea, constipation, or dry mouth/nose/throat. If any of these effects persist or worsen, notify your doctor or pharmacist. If your doctor has prescribed this medication, they have determined that the benefits outweigh the risks for you. Most people using this medication do not experience serious side effects. However, contact your doctor immediately if you experience any serious side effects such as mental/mood changes, trouble urinating, fast/irregular heartbeat, or seizure. A severe allergic reaction to this drug is rare, but seek medical help if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of potential side effects, so contact your doctor or pharmacist if you notice any other effects. If you are in the US, report any side effects to the FDA, and if you are in Canada, report them to Health Canada. Acetaminophen is an ingredient in this product. Taking too much can cause serious liver disease, so adults shouldn't take more than 4,000 milligrams a day. People with liver problems and children should take less. Don't use with any other drug containing acetaminophen without asking your doctor first. Acetaminophen is in many non-prescription and prescription medications, so check the labels on all your medicines to see if they contain acetaminophen. Get medical help right away if you take too much, even if you feel well. Daily alcohol use, especially with acetaminophen, may damage your liver. Before taking this product, make sure to let your doctor or pharmacist know if you have any allergies or if you have any health problems such as breathing issues, diabetes, glaucoma, heart problems, high blood pressure, kidney or liver disease, seizures, stomach or intestinal problems, overactive thyroid, or urination problems. This drug may cause dizziness, drowsiness, or blurred vision, especially when combined with alcohol or marijuana. It's important to avoid driving, using machinery, or doing anything that requires alertness or clear vision until you can do so safely. Also, be cautious if you have diabetes, alcohol dependence, liver disease, phenylketonuria, or any other condition that requires you to limit these substances in your diet. Remember to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products, before having surgery. If you are pregnant or breastfeeding, be sure to discuss the risks and benefits of using this medication with your doctor. It's important to be aware of potential interactions with other medications. Always keep a list of all the products you use and share it with your doctor and pharmacist. Certain products such as antihistamines, MAO inhibitors, and other medications that cause drowsiness should be avoided while taking this medication. Additionally, it's important to check the labels on all your medicines as they may contain similar ingredients, which could increase side effects. This medication may also interfere with certain lab tests, so make sure your doctors are aware that you are taking it. If someone takes too much of this medication and has serious symptoms like passing out or trouble breathing, they should call 911 or a poison control center right away. Symptoms of overdose may include nausea, vomiting, loss of appetite, sweating, stomach pain, extreme tiredness, agitation, confusion, flushing, hallucinations, yellowing of the eyes/skin, dark urine, and seizures. In children, excitement may occur first, followed by loss of coordination, drowsiness, loss of consciousness, and seizures. Make sure to attend all of your medical and lab appointments. It's important to stay on top of your health and follow through with any necessary appointments. If you forget to take this medication at your usual time, take it as soon as you remember. But if it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take extra to make up for the missed dose. This medication should be stored at room temperature, away from light and moisture. It should not be stored in the bathroom and liquid forms should not be frozen. Keep all medications away from children and pets. Make sure to properly discard this product and it is expired or no longer needed. It is important to consult your pharmacist or local waste disposal company and not to flush medications down the toilet or pour them into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.